want to say good morning, everyone. I'd like to call this meeting of the House Human Services Committee to order. And as a reminder, I'm going to ask you to please silence your phones and mute them, for this session is being recorded. Amanda, would you please take the roll?
Sure can. Good morning, everyone. Chairman Williams.
Here.
Rep. Bellman.
Designation.
Rep. Benham.
Here.
Rep. Serrato.
Designation.
Rep. Dural.
Here.
Rep. Green.
Designation.
Rep. Harris.
Designation.
Rep. Kahn.
Designation.
Rep. Kincaid.
Here.
Rep. Mays.
Designation.
Rep. Otten.
Designation.
Rep. Prokopiak.
Here.
Rep. Rivera.
Here.
Rep. Venkat.
Designation.
Chairman Heffley.
Present.
Rep. Anderson.
Present.
Rep. Baseline.
DVD.
Rep. Flick.
Here.
Rep. Flood.
DVD.
Rep. Hogan.
Here.
Rep. Labs.
Here.
Rep. McKenzie.
DVD.
Rep. Pugh.
Here.
Rep. Reichard.
Here.
Rep. Schlegel.
DVD.
And Rep. Weekneck.
Here.
We have a quorum. Thank you, Amanda. The chair calls up House Bill 1590, printers number 1835, introduced by myself and Chairman Heffley. Ashley, would you please read a summary of the bill?
An act amending the Act of June 13th, 1967, known as the Human Services Code in Public Assistance, providing for abrogation of regulatory requirements for payment for clinical services within physical confines of clinical facilities.
Ashley, thank you. The question is, will the committee report the bill? On that question, I want to thank my colleague for working with me over the past several months to ensure Pennsylvania is well positioned to implement new federal flexibilities that expand access to telebehavioral health services. I now would like to recognize Chairman Heffley, the co-prime sponsor, for any comments he might like to make.
Thank you, Chairman. This is working together. I like it. Getting some stuff done. This is an important piece of legislation. If you've ever referred to the four walls issue that's been going on, and I really want to thank Chairman Williams and our staff for working together and putting this together to roll back some of the state regulations and allow for the state plan to be adopted so that we can really increase that access to behavioral health services. So thanks for everybody for working together on this, and I would ask for an affirmative vote.
Chairman Heffley, thank you. Is there any discussion on the bill? Seeing no further discussion, those in favor of reporting the bill will vote aye. Those opposed, no. Are there any negative votes? Seeing and hearing no negative votes, House Bill 1590 will be reported from the Human Services Committee. The chair now calls up House Resolution 253, printers number 1411, sponsored by Representative Pugh and Representative Garal. Anne Marie, would you please read a summary of the resolution?
This resolution directs the Joint State Government Commission to establish a task force on enhancing access to drug and alcohol treatment in the Commonwealth and to submit a report to the General Assembly on its findings.
Anne Marie, thank you. The question is, will the committee report the resolution? Representative Heffley offers Amendment A01011. Anne Marie, would you please read a summary of the amendment?
This amendment adds a representative from the insurance industry who offers health insurance policies and a representative from a behavioral health Medicaid managed care organization to the advisory committee.
Thank you. The question is, will the committee agree to the amendment? Is there any discussion on the amendment? Seeing no further discussion, those in favor of the amendment will vote aye. Those opposed, no. Are there any negative votes on the amendment? Seeing and hearing no negative votes, the amendment is agreed to. Now the question recurs, will the committee report the resolution as amended? On that question, the chair recognizes the sponsor, Representative Pugh, for any comments on the resolution.
Thank you, Chairman Williams and Chairman Heffley. This is a very important resolution, and I'm really looking forward to finding out what the results are going to be. It's very near and dear to me, and I believe that, that we have a lot of gray area in which alcohol and substance abuse are affected, and I really want to try to find out how to get those people covered, to get them the help that they need, and to live the lives that they truly need. And I really want to, thank my co-prime here, Representative Gural, for working with me on this. And let's see if we can't get more Pennsylvanians the help that they need. Thank you.
Thank you, Representative Pugh. Representative Gural, remarks on the resolution.
Thank you, Chairman. I just want to thank the gentlelady from Luzerne County for her comments on this resolution. I echo her remarks. I would only add that this is a Pennsylvania issue, not a party line issue. So I urge all my colleagues to vote on the affirmative. Thank you.
Thank you, Representative. Seeing no further discussion, those in favor will vote aye. Those opposed, no. Are there any negative votes on the resolution? Seeing and hearing no negative votes, the resolution is reported as amended. The chair now calls up House Bill 1100, printers number 1176, introduced by Representative Parker. Ashley, would you please read a summary of the bill?
An act amending the Act of June 13th, 1967, known as the Human Services Code in Public Assistance, providing for waiver to purchase diapers or menstrual hygiene products.
Ashley, thank you. The question is, will the committee report the bill? On that question, is there any discussion on the bill? All right. Those in favor of reporting the bill will vote aye. Those opposed, no. Are there any negative votes on the bill? Seeing there are negative votes on the bill, Amanda, would you please call the roll?
Chairman Williams,
Yes.
Rep. Bellman,
Yes.
Rep. Benham,
Yes.
Rep. Serrato,
Designation.
Rep. Giral,
Yes.
Rep. Green,
Yes.
Rep. Harris,
Yes.
Rep. Khan,
Yes.
Rep. Kincaid, Rep. Mays,
Yes.
Rep. Otten,
Yes.
Rep. Prokopiak,
Yes.
Rep. Rivera, Rep. Venkat,
Yes.
Chairman Heffley,
Yes.
Rep. Anderson,
No.
Rep. Baseline,
BBD, yes.
Rep. Flick,
Yes.
Rep. Flood,
BBD, yes.
Rep. Hogan,
Yes.
Rep. Labs, Rep. McKenzie,
BBD, yes.
Rep. Pugh,
Yes.
Rep. Reichard,
Yes.
Rep. Schlegel,
BBD, yes.
and Rep. Weekneck.
Yes.
Amanda, thank you. With the majority voting in the affirmative, House Bill 1100 will be reported from the Human Services Committee. The chair now moves that House Bill 348, introduced by Representative Bonner, be re-referred to the Health Committee. Ashley, would you please read a summary of the bill?
An act amending the Act of June 13th, 1996, known as the Human Services Code, in departmental powers and duties as to licensing, providing for notice of legal representation for medical assistance.
Thank you, Ashley. On that motion, are there any questions? Those in favor of the motion will vote aye. Those opposed, no. Are there any negative votes? Seeing and hearing no negative votes, the motion is adopted. Thank you all for your participation today. There being no further business before the committee, this meeting is now adjourned.